As we head into the weekend, I thought it would be useful to update you on where we stand with COVID-19 in Ireland. Unfortunately, over the past 10 days, we've seen a deteriorating picture, with increasing incidence across most counties across the country, and our national incidence is now about 400 per 100,000 population. Unfortunately, we're seeing increasing incidence across most age groups, including in older age groups, and the median age of cases has increased from the mid-20s to now being 36 years of age. Unfortunately, what all of this means is that we're seeing an impact on our hospital system, with an increase in the number of hospital admissions and the number of people in hospital, with somewhere between 40 and 50 admissions per day on average. And unfortunately, we're also seeing about 5 admissions to intensive care every day on average. I know that many of you will be wondering why we're seeing these increasing case numbers. Why are we seeing more people in hospital and intensive care when we've had such a fantastic rollout of our vaccination programme? And whilst that vaccination programme has been fantastic and is now protecting over 90% of the population, the reality, unfortunately, is that 370,000 adults in this country have either not come forward at all for vaccination to date or have come forward for just the first of a 2-dose schedule. Unfortunately, what that means is that these people are as vulnerable to COVID now as they have been at any point in the pandemic to date. And unfortunately, their choice or their decision not to come forward for a vaccine is having a disproportionate impact on them personally, but it's also impacting disproportionately on admissions to hospital and on admissions to intensive care. Now, because incidence is so high at the moment in Ireland, the message today must also be about what vaccinated people can do. First and foremost, it's important to reassure people who've been vaccinated that we know that our vaccines are highly effective against severe disease and hospitalisation. But unfortunately, we also know that if there's enough disease circulating in our communities, a proportion of vaccinated people will get sick with COVID, will end up in hospital and will end up in intensive care. And we want to avoid that to the greatest extent possible. So a key message today to people who have been vaccinated is to not disregard all of the other basic measures that we've been talking about for so long now. First and foremost amongst these, and the most important message to everyone across the country as we move into autumn and winter, is that if you have any symptoms at all of COVID-19, please come forward and get a test and isolate. Don't assume that it's not COVID simply because you've been vaccinated previously. And finally, as we move into this autumn and winter period, the reality is that with vast parts of society open, we're now mixing and interacting with each other on a scale far greater than at any point in the pandemic to date. This gives viruses, and not just COVID, so the influenza virus, the respiratory syncytial virus, opportunities to circulate and to make vulnerable people very unwell. We can all play our part to prevent that by continuing to adopt the basic measures that we've all become so familiar with over the past 2 years. So let's continue to wash our hands regularly. Let's ensure that we don't meet up with other people and socialise if we've got symptoms. Let's work from home where possible over this autumn and winter. And for people who are aged 65 years and older, for people with underlying medical conditions, for children aged 2 to 17, for healthcare workers, and of course for women who are pregnant, please come forward and get the flu vaccination, because that offers you another level of protection as we go through this winter season. Thank you.